Alright, so I'm here in our digital radiography suite, and I'm going to show you the different personal protective equipment that we use. And first of all, I'm going to show you my dosimeter badge. This is my own personal dosimeter badge, and this is what we use anytime we're taking x-rays to monitor how much exposure and how much radiation we're receiving annually. So this would be worn. One of our pieces of personal protective equipment is our thyroid shield. So I would be wearing this along with all of my other equipment, and I want to make sure it's tight enough around my neck that it covers up my thyroid gland, which would be right in like the middle area of my throat here. And then I want my dosimeter badge to be clipped onto here as close to my thyroid as possible, kind of at the center of my mass. And so this just takes readings as it comes in. It takes readings through this little window of any millirems that come through. And then quarterly, so 4 times a year, our safety officer, David, sends these in, and we send them to an outside company who reads them and sends us a report, and then they let us know how many millirems per year we are being dosed with, so we can make sure we're being safe, there's no faulty equipment, we're not doing anything stupid to gain any excess doses of radiation. And I'm going to show you the report that we have here, so I can actually show you my own readings. So there's my last name, Woods. If you follow it over, we can see that I get about 135 millirems. The maximum permissible dose in the state of Washington is 5,000 millirems per year. And even our safety officer, David, so you can see here, David Zajac, he's at about 4,000 because he takes a lot of millirems, but that's just like over the course of his lifetime to date. So this is the millirems per lifetime to date, and he hasn't even hit the maximum millirems per year that he could hit. So we're really careful here, and we really do a good job of decreasing the millirems that all of us are receiving here in the hospital. And the reason that we want to make sure we keep that dose as low as possible is because the human body is made of about 80% of water. So when radiation hits us, the photons, when they hit us and the energy goes through, it goes through the water in our cells and hits, the bits of tissue in between. Primarily what we're worried about is our DNA, the double helix, because the photons of radiation can come in and they can break those bonds. Primarily becomes visible during cell division. So the more radiation that we receive, the more harm our DNA and our double helixes take, and then as our cells begin to multiply again, they can cause malignancies and they can cause tumors. If we were getting a high enough dose, it could cause death, but that's really only going to happen during a big, huge radiation disaster. And as you can see, based on the readings that we take here, we receive very, very small doses of radiation, and we do everything possible utilizing our personal protective equipment, keeping our KVP and our MAs at the best level possible, and collimating all of our images in to make sure that we're only shooting beams at the areas of interest so that we don't have excess scatter radiation coming back from the patients at us. And also, I want to make sure I take the dosimeter badge off whenever I'm walking around the hospital, because we don't want it to get excess radiation or millirems from anything else, such as computers or microwaves or anything that could give us false readings for our dosimeter badge. So we put it on near our thyroid shield before we take x-rays, and then when we're done taking x-rays, we put this back. We keep ours just outside of the x-ray suite in a little bin that's away from anything that could cause any radiation. Now I'm going to outline some of the other personal protective equipment that we use in our radiology lab here. So as you can see, I've laid out a number of items on our table. I'm going to go through all of them. So I'm going to go ahead and first, before I put these on, I want to make sure I inspect them for any defects. So this is our radiology apron. We should always wear one of these when we come and take x-rays. And as you can see, this one's maybe a little bit faded, maybe a few threads sticking out, but all of this area with the lead shielding that'll be covering my body, there aren't any big cracks or holes or anything that radiation could leak through. So I'm going to go ahead and put this on. it velcros back behind the head, and this one in particular also has a little tie that wraps around the back, so I make sure it stays on nice and tight and it doesn't come off while I'm taking my x-rays. Another very important piece of equipment that we should always wear is our thyroid shield, because our thyroid gland is right in here. That's also susceptible to radiation. So I'm going to put this on, making sure it covers my neck tight enough that it holds up high enough on my throat and it covers over my apron. This is also what I clip my dosimeter badge onto, because I want to make sure I'm reading around the level of my thyroid gland. And also this is close to my center of mass, so if I'm taking radiation, this will get a good reading. We also have a lot of other things that we can use in here. I particularly like these gloves. You can stick your hands in them. They have little loops for the fingers, so you can have your hand out to secure a patient or hold on to it this way. I can also stick my thumb all the way in here if I need to be able to move it around. We also have, we call these Gumby gloves, but they're just, give you a little more movement with your fingers, but they are a little bit stiff because they're lined all the way around to protect us from any of that scatter radiation coming off of patients. And then we also have some radiology glasses. These are available to everybody if we want to use them. Just protect our eyes while we're taking x-rays. And then for positioning patients, we have several different means that we can place them. We have things like foam blocks to put under limbs to kind of keep them in a nice stable position, make sure everything is aligned properly. If I needed to position a patient's limbs or hold its tail out of the way or anything like that, we have these helpful little tongs we can use to kind of pull on a limb, or we can use tape. We could also use surgical ties. Here at my hospital, we do our best not to use sedation if possible. If we need to radiograph a patient that's already under sedation, then great. But sometimes when pets are really painful, oftentimes the doctors don't want to compromise other body systems or their health by sedating them. But we do our best to keep as far away from the primary beam, which would be coming out right up here, as possible. Because the primary beam is really where all that radiation is coming through, shooting photons and energy down straight into the patient's extremity or body. And then, the image receptor picks up everything on the other side, but we want to stay away from that primary dose of radiation because that's what's going to be hitting the cells and possibly knocking any of the double helix formation in our DNA out of alignment. We also have these foam troughs. So as you can see, this one's a little bit older. It's got some cracks here, cracks along the line. We have some, it got cracked along here at some point and someone put some tape along there. All of those are going to be non-diagnostic. In an x-ray, those could show up, let the radiation through, and have, different effects on our x-rays that we don't want in there. So we have brand new foam troughs that, as you can see, they're nice and shiny. There's no cracks anywhere in the material. We have straps on the end if we want to, strap a patient's leg in that way. So we make sure to keep the nice brand new foam troughs around. And then if this were to get cracked, we would either dispose of it or it would be our brand new trough for cystocentesis to hold patients there. But for radiation, we want to make sure that there's nothing in the way that would cause an artifact. And so that's why it's so important for us to utilize all of these pieces of equipment, is because we want to stay as far away from that primary beam of radiation as possible, because that's what's really going to disrupt the bonds between the DNA in our double helix. And so pregnant women or people under the age of 18 who are still growing are the ones who are mainly going to see effects from radiation, because they still have cells that are dividing. And so if the DNA gets compromised, then you're going to see malignancies or possible birth defects or possible carcinogenic responses from radiation if they still have cells that are growing. Any non-essential personnel should be removed from the x-ray suite, because we want as few people as possible to be submitted to the primary x-ray beam, and also we want to stay as far away from the patient as possible, because we just want to make sure the fewest amount of people and the smallest part of us is subjected to any radiation because some of the photons can come down, bounce off the table, or bounce off of the patient. That's called scatter radiation, and that can come back and hit us too. So we want to do everything we can to stay as far away as possible from that primary beam or all of our personal protective equipment so that if any of it does come through, it bounces right back off. Alright, so I'm going to take a right lateral view of a tibia and fibula. This is Mr. Lucky. He's being very good. We're doing some non-manual restraint with some of these heavy arm guards here. We have his right foot taped down to the table, and he's in right lateral position, so we're going to be getting a view of this leg that he's been limping on. I have my screen here collimated in on his tibia fibula region, and it's including the hock joint and the stifle joint up top. And I've collimated this in as closely as I can to make sure there's as little scatter radiation as possible. And as you can see, the highest point of this radiograph is going to be around 5 centimeters. And so we have a little size chart here. Since we have a digital x-ray system, if it's 1 to 10 centimeters, our KVP is set to 80 and our MAs are set to 2.5, as you can see here. Good. So now we have everything collimated in properly and our patient is secured to the table. So we're going to step back. And I'm going to pull his leg out of the way. Here we go, Lucky. Good boy. Making sure I'm staying out of the primary beam. I'm going to go ahead and take an x-ray here. Good boy, Lucky. Alright, so I'm going to be taking an image of Mr. Zico here. He's a good boy. So I'm going to utilize some of our equipment and show you how we can utilize different things to stay as far away from the primary x-ray beam as possible. Being a very good dog, I know. So we have some tongs here we can use to pull their extremities out of the way and keep our hands further away. We also have some tape that we can use. We can also utilize some foam pads or a trough, and we're always going to wear our gloves. And Mr. Zico here doesn't need to go in a V-trough because we're going to be taking a picture of his extremity, so he's actually in a pretty good position here. I'm going to use my calipers, which are a little big for his tiny arm, but that's okay. We're going to measure what is done. It's okay. I'm going to measure at the thickest part of his arm. So the thickest part of his arm's going to be right here in front of his elbow joint, and that's at about 4 centimeters. Anything between 1 and 10 centimeters, we're going to set our kilovolt peak at 80 and our milliamperes per second at 2.5. So I went ahead and I've already set that because I know that he's a tiny little guy. And now we can get him in position and take our x-ray. So now I'm going to make sure that that is in the primary x-ray beam. I'm going to collimate down. Alright, so Mr. Zico here is being a very good boy. I have his paw taped, and I have everything collimated in so that it'll still get his stifle joint and his elbow joint, but it's collimated in as closely as I can. That allows the marker to still be in here. And since he's being a good boy, no one else needs to be in here with me, so I just need to make sure I get his head up and out of the way. Oh, that's such a good boy. Just going to make sure my alignment is good. That looks wonderful. Keeping everything not exposed out of the primary beam. And then take my image. Oh, that looks beautiful. You are a good dog. So we're taking a right lateral abdominal radiograph of a kitty cat. And this cat is 1 to 10 centimeters, so I've taken the KVP down to 80 and the MAs are at 2.5. We're making sure to get all the way up halfway through the rib cage so that we get the diaphragm. So feel to the xiphoid process. That's where I'm going to cut off. I want to make sure I get all of the abdomen. I'm going to try to get her spine as straight as possible, but she seems a little painful. So we'll see what we can do here. Our markers at our ventral aspect, and then we're going to take the radiograph right when she's exhaling. Good. We did that to the best of our ability. She's breathing a little fast. All right, so I'm going to take a ventrodorsal view of Miss Georgia's thorax here. We have her in a foam trough, and she's still awake. She's not sedated for this, so the tape probably wouldn't work on her, so I'm going to make sure with these arms that I'm holding her with, I'm covering up with my gloves. I'm going to make sure I have one on each side. And I already measured her and set the kilovolt peak and the MAs accordingly. All right, Georgia, so we have the bottom of her diaphragm down to her xiphoid process, all the way up through, hi, can you put your head back down? All right, and I'm gonna go ahead and make sure I take the x-ray as she's inhaling, right there. All right, good girl, Georgia.
You're sweet.
There we go. Oh, and that's a nice view.
Yeah.
Okay, now I'm going to take some dental x-rays of a canine mouth. This is Bella here. We've already kind of arranged her mouth. I'm going to be taking some radiographic images of her upper incisors, 101 through 103, and 201 through 203. There we go. All of those teeth. So from this angle, I've already put my plate in here underneath her incisors. This is our sensor pad. We've wrapped it in vet wrap so that it's nice and protected, because that's an important sensor. We have this padding down below just in case she wakes up and decides to bite down on our equipment. And I have the angle of the plate here, the angle of her tooth root, and then my bisecting angle that you can see. We've kind of rearranged those here with some Q-tips. So then from the bisecting angle, my sensor is parallel. So hopefully that shadow will kind of fall right on the sensor plate. We'll get a nice good diagnostic image when we take the radiograph. And then I'm going to come down from a rostral perspective and take a look. And my sensor is nice and parallel in between the nares. And I have a nice view, so hopefully this will be a great shot. And then we always want to make sure we use our personal protective equipment. So I'm going to pull up a lead shield that we have had fashioned here in our hospital. I'm going to put it in front of the patient, and then we're going to take our image real quickly. And I also have to come over, we have a digital radiography system here, so I'm going to select the teeth, and I can select any of the upper incisors, and it'll kind of focus on what area I'm using. And this machine luckily also sets the kVp for us, senses the power, and then we'll adjust accordingly. So I'm going to hide behind my shield here. We're going to take an image. Okay. It should show up on the screen. All right. So we can zoom in a little bit here on that image. So this is a good shot of those upper incisors. Everything's going to be a little flipped on our radiography screen. So this is actually the left-hand side. So we got a good shot of these 4 upper incisors, 101 and 102 and 201 and 202. We got the root tips here of 103 and 203. We didn't get all of the crown in, but this is a nice diagnostic image if the doctor needed to look at just the root tips. Okay, so now I'm going to be doing some of the lower right carnasial teeth and premolars. So we already have the sensor placed back here. There's a little room underneath in between where the maxillary arches reach that we can push the sensor down. We still have our padding in her mouth in case she decides to wake up a little bit and bite down on our expensive equipment. So this sensor's lined up, so hopefully it'll get the crowns and most of the roots of these teeth, which is more what we're focusing on. And since I can get the sensor further in her mouth, I can line this up to be a little more parallel. We tilted it slightly downward just a little bit so we can make sure we get those roots on the image. So now I've already selected the tooth of interest in my digital radiography system, and now I'm going to pull our protective sheet in between us and the patient so we don't get irradiated, and I'll take the film. Okay. It'll show up on the screen. All right. And that's a nice image of that carnasial tooth. You can see the outline of the roots on each side. It cut off a little bit of the crown on top, but we're primarily concerned about the health of the root underneath. You okay? Alright, so I'm going to show how we label our x-rays. We have a digital radiography machine, so I'm just going to put the patient information straight into the computer. So I'm hitting the patient button, and I'm going to put in his name, and we do last name first, so we're taking pictures of Mr. Lucky Gossman, so Gossman. I'm going to do a space, Lucky, with his first name, and then for ID we have our own 5-digit hospital ID code that we always use. So I'm going to put that into the system, followed by his first name so that we can easily identify him later. And then we're going to select he's a male. I'm going to put his birth date in as well, so it easily has his date of birth and it calculates his age for us. I'm going to hit study info. We're going to select his species. He's a neutered canine. And this is going to be under one of our many doctors. This is under Dr. Nicole Varallo today, so I select that. And now all of this information is automatically going to print out on a digital label that it'll put in the corner of each x-ray for us. And then I can select after we take the images where that information is so that it's not in the way and we still get a nice diagnostic image. Alright, so now that I've demonstrated how to put Mr. Lucky Gossman into the system and sent the x-rays over and taken them, I'm going to show you how we retrieve them to view them out here. So we go up to File, and I'm going to hit Search, and then I can search for him based on his patient ID, his last name, or his first name. So I'll search him by his last name, Gossman, and then we can search by the date too, so I want to deselect that he's got them taken today, and I'll just search for how many of them. So there are 2 Gossmans in here, and this is Mr. Lucky. So I'm going to go ahead and click on him. It says close the current window, yes. And then it'll find his x-rays.
Makes me look busy.
Okay, and then I can change the views on here. I can see how many images were taken, and here's that tibia fibula shot that we took earlier. And now we'll go and search for a second patient. Let's go ahead and look for Miss Skittle since we did our barium study on her. So I'm going to search by her first name this time. And there's only one Skittle, so you can see all of the different images that we took for her barium study. And that's how we look up images here. Alright, so now that we've labeled Mr. Lucky's x-rays and I've shown you how we view them, now I'll show you how we log them. So we use a digital system, but if we had a regular system, we would use a log similar to this. So we would say the date, the number of films, and the name of the client, so their last name and the patient name, things like their species and breed, and then what we're taking an image of, the KVPs, the MAs, what doctor it's under, and any special comments. We want to make sure we log all of that information. And then as far as entering these into our medical record, I'm going to go ahead and show you here. Here we go. So this is our digital medical records. So these were entered in. We have a SOAP, so this shows that Dr. Varallo saw him that day. We see here diagnostics. We did x-rays, VD, and a lateral pelvis. We sent them off to Northwest Veterinary Imaging for review. And I also did that lateral tibia fibula. We kind of include that in the pelvis here. And then if I wanted to go ahead and link the radiology report, I have that down here. You can view, it came in, the specialist already reviewed it. I would go to link, and I would hit add item. I would have to put in that I'm the provider, and then I look for the file, and here it is right here. I have Mr. Gossman Lucky's radiology report, and I would hit, and then I could display this, and it shows it on here. And then as I save it, I'm going to exit because this has actually already been linked in his record. But then as you can see down here, about 3 days after we sent it in, he got his radiology report linked in his system. So that's how we show that. And then if I wanted to link his actual x-ray, I would do the same thing. We would set this as a link, add item, and then I would just go ahead and search for that, and that's going to be Mr. Gossman's tibia fibula here, and then we can view it in his medical record. Alright, so we're going to be doing a GI study on a canine. This is Skittles. So we're going to go ahead and get her all placed here. I've set the KVP, so the kilovolt peak here, up to 110. And the MA is at 2.5 because, as you can see from our chart, she was around 20 centimeters, so she's in the 110 KVP range, and I already set that. Hi, Skittles. Okay, sweetness, we're going to lay down. Yeah, lay down. Oh, it's a good girl. I know we're going to see what's going on in your tum-tum today. So we're laying her in right lateral. We're going to take an abdominal view, and we can move the table back. Stay, Skittles. That's a good girl. Okay, and move her forward. Perfect. So I'm making sure I get the entire abdomen in this shot. I'm going to collimate in slightly. All right, I can push her forward. There we go. So I'm feeling here. The ribs end right around here, so her diaphragm's going to be in this general area. I'm going to go just an inch or so up from the diaphragm and make sure I get the entire abdominal cavity. And then I'm going out past, I can feel her ischium right down here, so that should get most of the entire pelvis and the entire abdominal cavity here. I know you're being a good dog. Can you stay? No, stay. I'm going to place my marker. We're already wearing all of our protective equipment except for our gloves here. Stay, Skittles. Okay, I know. So now I'm going to heat up my machine. And once she exhales, I'm going to depress and take that photo. Now we can go look at our x-ray. All right, so now that we've taken our first abdominal radiograph, here's Mrs. Skittles. She's eating her delicious barium-soaked breakfast. So we can go ahead and just offer her barium with just a little bit of kibble, and she's just chowing down. So this is the barium paste that we used. I mixed in 144 milliliters of water with 36 milliliters of barium, so it was a 20 to 80% mixture. And then we're going to go ahead and set a timer for 15 minutes, and then I'm going to take another lateral abdominal x-ray and see where the barium shows up. Okay, so now we're taking another right lateral abdominal radiograph half an hour after giving Skittles her barium. So I've set my kilovolt peak and my milliamps per second to the same that they were before. We have her placed in the same amount, or the same place that she was before, so we have all of her abdomen. We're including parts of her diaphragm, hopefully up a little higher to include her stomach. Good girl, Skittles. We're wearing our personal protective equipment, and we have our marker in place. So I'm going to go ahead and take this picture. I'm going to do it when she's exhaling. There you go. Oh, Skittles. Oh, Skittles. And luckily, we got that image right before she moved. All right, so now we're going to take another right lateral radiograph of Skittles' abdomen. It's been about 45 minutes after she had her breakfast. So I still have my KVP and MA set at the same amount, 110 and 2.5. And we have our lines here. This should be up at the edge of the diaphragm so that we'll include the stomach, and then we're going to include the entire abdomen here. So stay, Skittles. Okay, I'm going to go ahead and wait. Stay. Hey, stay.
Skittles, stay.
And I'm going to hit and push when she's exhaling. Here we go. Okay, so now our post right lateral radiograph after Miss Skittles has eaten her barium. We have our KVP at 110, our MAs at 2.5, and we have our marker at the ventral aspect. We're covering her diaphragm, getting her stomach and all of her abdomen in here. And I'm going to go ahead and wait, Skittles, until she exhales. And keep my hand away from the primary beam. Alright, so this is our final x-ray for our barium study. This is about an hour after the last one. She's still in her right lateral view. We're going to take the image still at 110 kVp and 2.5 MAs. The marker is on the ventral aspect of the patient, and I have all of my information set in. So now we're going to go ahead and depress, wait for the machine to heat up, stay, Skittles, And then we'll press it when she's exhaling. Perfect. Good girl, Skittle. All right, so we took all of the x-rays of Miss Skittles, and as you can see, so first we took the right lateral abdominal view so that we could get a good look of her stomach and her intestinal tract before we fed her the barium. And then we fed her the barium and kind of tracked where it was going through her intestinal tract to make sure that there aren't any obstructions or anything. So as you can see on here, her stomach at the beginning, this was right 15 minutes after we gave her the barium, and then 30 minutes after we gave her the barium, 45, an hour, and then an hour after that. And as you can see, it's kind of starting to work its way into the rectum and the colon. So we just kind of were tracking through. It doesn't look like she has any obstructions, and we could follow the tract of the barium and see that it was more hyperechoic than everything else in the intestines. All right, so now we're going to take some VD views of Mr. Bodie's pelvis here for canine hip dysplasia. So he's sedated. He just had a dental cleaning. He's a little over 2 years old, so we're going to test the laxity of his femoral head joint here. So he's sleeping. We have him under sedation. I have kind of a glove up here that's just holding his upper arms up. My KVPs are set to 110 because I measured him previously and he's above 16 centimeters, so we have him at 110 KVP and 2.5 MAs. I've taped his legs here to make sure that the stifles are turned in enough, and I'm just going to glove up and make sure I grasp at the metatarsal region. And then I'm going to pull down slightly, just rotate in a little more. I'm trying to line up the stifles over the tops of the femur, the epicondyles. Now I'm going to go ahead and I've made sure to get the top of his pelvis to hopefully include the wings of ilium. I'm going to take my x-ray here and hopefully all the way down past the stifle joint. And I'm looking to make sure his femurs are nice and parallel. Okay. And to make sure that the stifles are turned in over those femurs.